Welcome to Metis. Today I'll be talking about the Human Organ Transplantation Act of 1994. The Human Organ Transplantation Rules was framed by the Central Government in 1995 along with 13 statutory forms. The Eardrums, Earbones Act and the Eye Act was implemented in 1982. Now let's see what human organ is. According to this act, human organ is any part of the human body where the tissues are structurally arranged, and if this part is removed completely, it can't be replicated. The main organs donated include heart, liver, kidney, lungs, pancreas, eyes, eardrum, earbones, and so on. An organ is removed after the death of the person, and this death is certified by a panel of experts consisting of the medical officer of the hospital, neurologist or neurosurgeon, and the doctor treating the patient. Now let's see what are the aim of this act. The aim include, first is to stop any live unrelated transplant. Second, if it is a live related transplant, the donor and recipient should be genetically related, and with the exception if the donor and recipient had done with the approval from authorization committee. And the third is to accept brain stem death criterion. The removal can be done at any place. It is done only after getting authorization from the person who is lawfully possessing the body. In case of unclaimed bodies in hospitals or prison, removal should only be done after 48 hours. Organs are removed. Sometimes these organs removed will be preserved. This is to ensure the viability of the organ, and this should only be done according to the current and accepted scientific methods. Organ should not be removed for purpose other than therapeutic purpose. The doctor who is doing the removal should explain all the effects about the hazards and complications of removal and transplantation to the donor and recipient. For hospitals which are engaged in the storage, removal or transplantation of the organs, compulsory registrations should be required, and this registration is provided by the authority. This authority, which is appointed by the central or state government, can renew registration, they can grant the registration to hospitals, they can renew it, they can suspend or they can cancel, or they can also provide certain conditions about organ transplantation. The central or state government can also appoint an authorization committee with nominated members. These members can impose restrictions on organ transplantation or removal. In case of any unauthorized removal or contravention of the provisions of Act, punishments are provided. These punishments given will depend on the nature and the degree of the offense done. And the punishments include the removal of name of the medical practitioner from the register of the State Medical Council. In case the practitioner had done his first offense, his name will be removed for 2 years, and if subsequent offense is done, his name will be permanently removed. An imprisonment up to 5 years is given, also with the fine of rupees 10,000. And offense is cognizable. It is considered cognizable only if the complaint is made by the authority, or the person had given notice to the authority with intention to make any complaint to the court. And this is all about the Human Organ Transplantation Act. Thank you, and see you in the next section.